Thank you.
Hello, everyone, and thank you for joining us for the Every Ride Counts pilot projects discuss their experiences webinar. Today is Tuesday, January 14th, 2025. And so just a few quick housekeeping. So the instructions for today's Zoom, all participants are muted. The session is being recorded and all materials, including the recording, will be put on the NADTC website by the end of the week. Closed captioning is available. You can turn on your captioning / subtitles by clicking on the CC button at the bottom of your screen. Please put any questions in the Q&A button. It will be open for the entirety of the webinar. The chat is open and can be used for general comments or technical assistance. So about the National Aging and Disability Transportation Center, we are a partnership between US Aging and Easter Seals, and we are funded by the Federal Transit Administration. Our overall mission is to promote the availability of accessible transportation options that serve the needs of older adults, people with disabilities, caregivers, and communities. Now I will turn it over to Virginia Dyes and Jeremy Johnson-Miller to talk more about the NADTC and today's webinar.
You can find us on our website as well as through monthly e-news. And so our website is nadtc.org. If you want to use the QR code that's on your screen, that'll take you directly to signing up for our monthly e-news, where you'll get all of the updated information of everything that we're doing, including the grant opportunities or new materials that are coming out, a lot of information that we like to share with our followers as well. You can certainly follow us on social media. Primarily, we use Facebook and LinkedIn to get our information out, as well as YouTube, where a lot of our recordings and different types of trainings are housed. So with that, I will turn it over to Virginia, where she will kick off today's session. And you're on mute, Virginia.
I always do this. Excuse me, people. Virginia Dyes with NADTC. I work at US Aging, and I did want to point out that Meredith Bratton, who introduced this session, is one of our technical assistance specialists. And so if you use our toll-free number, you're likely to speak with her or with her colleagues. Just know that we are eager to receive your calls if you have any technical assistance questions. I did want to say a couple of things about the NADTC website, because we've made some changes, and we're in the process of making some changes to the website. We're very thrilled that we currently have these materials that were developed as part of our pilot project. But right now, we do not require registration any longer to access the Every Ride Counts materials. We're pleased to make that change. Previously, you had to register, you had to get a login, and once you did that, you had access to the entire site. Well, right now, you have access to the entire site. You can see it all. You can download materials. You can customize materials and use them in your own program. We are in the process of reorganizing the Every Ride Counts site so that it's a little bit more attractive and it's easier to navigate. And stay tuned. We will be making an announcement of those changes in our e-news. Next slide. So without further ado, we're going to move into today's presentations. We have 5 pilot sites that are represented. Emily Braley and her colleague, and I'll ask her to introduce her colleague when she starts speaking, will be representing NV Rides in Fairfax, Virginia. Jeff Keithley is unable to join us today, so Jeremy is going to be providing the presentation on the Allen Regional Transit experience with Every Ride Counts. That'll be followed by Laura Lowe from Hope Link in Redmond, Washington. And then Jeremy, once again, is going to be talking a little bit about the Mountain Rides pilot site. And finally, but certainly not least, will be followed by Lynna Mitchell, I'm sorry, with the Appalachian Area Agency on Aging and the experience of Four County Transit, which is a transit organization that's affiliated with the AAA in Cedar Bluff, Virginia. So with that, I'm going to ask Meredith to turn to the next slide and turn it over to Emily.
Hello, thanks for having us. Elena Allergan is my colleague and she's going to start out.
Hi, my name is Elena Allergant, and I'm happy to be here today for my very first time with NADTC. So I'm a manager of NV Rides Volunteer Transportation Network in Northern Virginia. We're an umbrella organization that supports a network of volunteer drivers program who make transportation for seniors possible in Northern Virginia area. We serve in 4 counties: Fairfax, Arlington, Loudoun, and Prince William. We have 15 partners. Can you please do next slide? Yeah, thank you so much. Yeah, we have 15 partners in Northern Virginia. Most of them are shepherd centers and senior villages, also community centers. So what we do for them as an umbrella organization, outreach is the main part of our work. For 2024, we did 60 outreach events in Northern Virginia. These outreach efforts can help us increase our visibility through the community. We collaborate with local senior centers and community organizations. We constantly do volunteer recruitment, tabling at community events and farmers markets. We also use social media for volunteer recruitment. We maintain user-friendly website, engage with the community through social media platforms. We distribute information materials at senior living facilities, libraries, and recreation centers. We participate in local health fairs and community events. We support educational initiatives by offering workshops on seniors' mobility and transportation issues. We do advocacy. It's an important part of our work. We participate in community planning meetings related to transportations and senior services. We provide software solutions for our partners. We cite administrators on our software Ride Scheduler. This software allows to keep track of volunteers, rides, clients, miles, etc. We also facilitate and fund background checks for our partners. Next slide, please. Before I describe profiles of our riders and drivers, I want to give you some numbers from 2024. Yes. So our statistics for last year, we provided more than 27,000 rides for seniors. We have more than 1,000 riders and more than 700 volunteers. But under those numbers, are hiding the most important and valuable part of our program, the people, our riders and our volunteer drivers. So who are our drivers? They are often caregivers of those who benefited from programs like NV Rides. They sign up to drive through within their community. They are mostly retired. Their average age is 69 years old, and they use their own cars and gas. Who are our riders? They need to be clients with our partners. Their average age is 79 years old, so they are older than drivers. They have to be independent cognitively and physically to get in and out the car. They usually on limited financial resources, and they often have some chronic health issues. They usually have limited family support. They really need people who can help them. And through our outreach efforts, we can find more volunteers to help them. Emily will tell you more about RIP cards that made volunteer recruitment more effective. Emily.
Yeah, next slide, please. So when we first started with NADTC, we sat down and they talked about how we recruit volunteers and how we do outreach. And we, of course, need more volunteers. We have lots of riders. We love our riders, but we always need more volunteers. So we talked that most of the time we recruit our drivers in person. So we loved the idea of grip cards, and we knew that we weren't reaching our whole community because we didn't have any materials in Korean and Spanish, which are common languages in this area. NADTC was amazing and helped us get all these materials trans-created, which is different than translated. It means that they were actually workshopped with native speakers of that language, so they make sense culturally, they make sense linguistically, the images match, everything. So it was really great to get this trans-creation process done for us because it's a time-intensive process. So we had grip cards made for volunteer drivers and riders, total of 6, Spanish and English and Korean. And then the other thing we wanted to try that we hadn't done as much was digital marketing. So they helped us set up digital marketing campaigns to recruit volunteer drivers. And we found out the messages that are most effective are things about making friends, social connections, and getting out of the house. So that's kind of where we emphasized. Next slide, please. So I'll start with our print materials. These were great. So before NADTC stepped in with Every Ride Counts, we were using a trifold brochure, didn't love it, had a lot of words, wasn't popular. You can see it on one of the stands here. And then NADTC helped us make these Every Ride Count grip cards. They're very eye-catching, high contrast, and also pretty simple wording. So we had 24 libraries got the materials. We did 18 public sites, some of which were like restaurants, district supervisors' offices. We got 2 Spanish-speaking volunteers directly from these in the few months we did the pilot project. We recruited 39 volunteers, which is an 8% increase in our like baseline intake rate. So it was a great project. You can kind of see what they looked like and where they were living in the world. Next slide, please. So then we did a digital marketing campaign that was on Meta products, which is Facebook and Instagram. I have a screenshot of what it looked like on Instagram. Big reach, 160,000 post reach, 60% increase in Facebook followers, 5,000 people clicked, which is pretty great. 355 leads, which means people opened it, and then 55 actual emails came to me from people who wanted to consider volunteering. So I would say pretty successful, very eye-catching, and we still use the materials. Like if you see us around, you will see us with these materials. So thanks to NADTC. And we will be using these going into the future. I will pass it on to the next speaker.
Great, that is me. So as mentioned before, Allen Regional Transit is unable to attend today, but I was working directly with them, so I do know a lot about their program and what they were looking for. So I just have a few quick bits of information. So their priorities when starting this activity was they really wanted to create new materials because they were in the process of creating a new standalone transit program. Previously, it was operated under just their general organization, Thrive Allen County, but they were trying to branch off into Allen Regional Transit. And so this was really good timing for them to join this project and help create some materials that they were going to start using and promoting. And so really they wanted, because they're a new program, they really wanted to just increase the visibility within the communities that they serve, especially being already in the community, but just a newer type service with different branding and such. And so they really wanted that help to increase the visibility. They did mention that they have a lot of working sites or facilities, factories in their area. And so they had a lot of long distance trips between different communities. And so that was a big priority to make that connection. And they had already been in connection with some of those facilities and factories to have that conversation about different work trips. And so those key priorities are what we were working on with them as well. Next slide, please. So through this project, we were able to assist with creating 268 radio ads. And so their primary focus or way to get the word out was word of mouth and radio. So they hadn't really had a lot of luck with doing a lot of social media outreach or placement of different ads, but radio seemed to work pretty well for them. That's why you see a really high number of those radio ads that they were working with. They also had several localized newspapers and smaller town newspapers that maybe came out once or twice a week. And so they wanted help with placing those ads in the smaller town newspapers as well. We did create some different graphics for them to use and generate on Facebook and Instagram. They did not, as with their Allen Regional, that was a brand new service. They did not have a Facebook page for that. So that was a part of this process in getting that started and, you know, just having good graphics that they could use as a part of that newer service. They wanted several flyers to be printed so they can go out to different events and when they're talking to people as well. They wanted postcards as well that they could do mailings to get out the word to the people, as well as magnets. The one unique thing I wanted to highlight is they wanted a banner that they could use when going out to different events as well. So we got to venture into that and getting it printed and large enough that they could use. And so they were really happy when they got that banner. On the next slide, I have an image of that banner that we created for them. It's 3 foot by 6 foot. And so they're able to either put it on the wall when they have an event or along a table. 6 foot is the typical table size. So that's where we got the 6 foot. But they're able to use this now and promote their services when they're out in the community. Next slide. Here's also a view or image of the postcard that was created. As you can see on the left is kind of our standard branding that we were using throughout this campaign. On the back is where they can insert the address or where they'll be mailing it to. So that's where you'll see that white block there on the right. And so that can be customized as well. So as mentioned, they did a lot of mailings and a lot of outreach through the mail. So that was one of their priorities. And I believe that is, and so I also wanted to include, with both of my groups, we did radio ads, but I wanted to include just a sample. And this came from the final report that we put out as well, but it was just a quick, simple 30-second ad, and they had someone read that for them, and it would be placed on radio between different segments. And so just really quick and easy, quick and simple, including their phone number to get a scheduled ride easy. So that is, in a nutshell, their program with Allen Regional, and I'll pass it off to the next speaker.
Hello, everybody. My name is Laura Lowe. I use she, her pronouns. I'm a woman in my late 40s with brown and gray hair. I'm wearing a black sweater and a salmon colored shirt. The first slide shows some of our materials from the Every Ride Counts campaign. We have materials here in Spanish and in English, an infographic, as well as our palm card. Our palm card is our most used. We're still using that today. The palm card I'm going to describe because that's still kind of our main thing that we're using now. Our inclusive planning process focused on large font and high contrast and our branded colors. There's a person who's seated in a wheelchair with a door that is opening and a person standing next to them to represent volunteer transportation, which is usually done in a personal vehicle. Yeah, so that's kind of our main marketing that we've been using. Next slide. So what is Find a Ride? Find a Ride is, we're not a transit agency. I'm on the mobility team at HopeLink, which is a community action agency in Western Washington State. We were doing community testing for Find a Ride's trip planner, and it was such great timing with the Every Ride Counts campaign. We were so happy to be part of this pilot. You can check out our website and our trip planner at findaride.org. And we really have this challenge of communicating so many services. I'm going to show in the next slide all the services in our trip planner. So next slide. So this has many, many logos. I'm not going to read all of them, but I am going to describe the types of transportation. We have fixed route transit, deviated on demand, mixed with fixed route transit, volunteer, last mile solutions, monorail, ferries, and more. I'm not even naming all the types of services: tribal transportation, rural, urban, across 3 counties. So we were trying to figure out how to communicate that, and really appreciated the support from the Every Ride Counts campaign as we developed different materials. Next slide. So lessons learned. We learned so much. We learned a lot about accessibility. From our committee, we have an inclusive planning process. We're part of the King County Mobility Coalition with partners across Pierce and Stonebridge County, including people with disabilities. We're very active in designing the materials and providing feedback. We focus on older adults and people with disabilities and trusted partners that work with folks with limited English proficiency, as well as low-income individuals. And they were all involved in this process. So we had several advisory committees focusing on this process and really designed it with the community, and had a lot of tough conversations about priorities of what we were communicating and how. And so we can go to the next slide. So our community impact as part of the Every Ride Counts campaign, what we got was 800 flyers in English, Spanish, 800 palm cards, 2 languages, 90 posters, 600 magnets, 120 infographics, and a social media toolkit with 6 graphics. We really relied on partnership marketing, which means although we don't have that social media presence, as was mentioned earlier, we didn't have that yet, but we did rely on all of the advisory committee members to put on their social media that we were in this community testing phase and we needed feedback about the trip planner. The image on the slide shows somebody bending over at a table to test out the trip planner. The Every Ride Counts materials are on the table, and a really great kind of high contrast colors that stand out on a table. We also had folks from the community there, people with disabilities. And what was great is that our tabling sparked a lot of intense and wonderful conversations about specialized transit, the gaps, the challenges, and stuff at this event. So it served kind of to spark that community discussion that could lead to advocacy and policy changes. And we saw an increase to our website, 25% increase to our website during the Every Ride Counts campaign, and a 5% increase in the click-throughs to send an email to us, which shows that our limited marketing, which is really just 5 marketing events with these materials, had a big impact. Lots more stuff in a report that I can link you all to if you go to the next slide. These are images from our outreach. So we went to a transportation summit, we went to a senior center, we went to a in-language Spanish kind of social community meetup and spoke with them, food market, and a farmer's market. So those were our variety of outreaches that we did. It was super fantastic. Next slide. And again, all the details of and what we found, especially in terms of accessibility and materials, is in our marketing report that we did. You can try out the trip planner, and you can reach out to me, Laura Lowe, or Stacy Sahu, the Director of Mobility Management, and wanted to include this photo here of our celebration with all of our advisors. So when we make decisions for Find a Ride, these are all the folks that help make that decision. It's a really exciting group. And it's an exciting way to do inclusive planning. And thanks to WashDOT, King County Metro, Sound Transit, and HopeLink for their support of this project, and NADTC. Again, we're still using the materials that were developed in the campaign, and we're so happy to be part of this.
All right, on to Mountain Rise, which is located in Ketchum, Idaho. They are a smaller operation. They are up in the foothills and the mountains, and so as you can imagine, that is a little bit hard to navigate at sometimes during the year. But they do also wanted to focus on some of those longer distance rides. They already had a route that would go to a large medical facility that was already in place, like I mentioned. But through this effort, they started noticing that other folks were jumping on the bus and noticed that they were going to work and everything. And so a lot of that fact finding happened during this project where they discovered, oh, maybe not everybody is going to medical appointments and some were going to jobs. They relied heavily on word of mouth and newspaper ads, radio ads. They had never really formally had a marketing campaign or they had a logo, they had a website, they had social media, but they had never really had a formalized campaign put together for them. So this was also a really good opportunity to develop those materials and have more tangible things that they can hand out and give out in the community. They did have an existing Facebook page, but they wanted help and assistance to enhance that and use it a little better. So something that we were a part of was they gave us access to their Facebook page so we could look at and track some data, look at their usage and how they were using it. Just so they could track that to see what was happening with their social media. And so I did check the other day and they were up past 1,800 followers. So it's a pretty good stat to look at for their Facebook page when they weren't really using it very, very much when they started, but through this effort, we were able to help them with that. Next slide. So through our efforts, we are able to create 90 different radio ad placements, 7 newspaper ad placements in various little towns that were in their area, created 20 digital and social media graphics that they could use on their website or on social media. They specifically wanted bus posters that could go on the bulkhead within the bus itself. And so I do have an image of that coming up soon, but also standalone posters that they were able to either post in grocery stores, libraries, the medical facility that could be posted around and advertise their service as well. They wanted 1,000, they call them rack cards, but they're I think 4 by 9 in size, and so they could easily fit on different counters throughout their community, both in English and Spanish, as well as 500 magnets also in English and Spanish. Next slide, please. Here's that poster I was talking about. So it's a little bit bigger, it's a little bit wider, and so again, just advertising their service and using the graphics that were provided. And they had really good feedback and they said it was a really good experience for people to be able to see what the services offered. And again, they had some really good feedback on the graphics that were used. Next slide. Here's that visual of their rack card. It is a front and back. So the front shows one of their vehicles with the driver helping an individual getting into their van. And on the back, it has a little bit more information on the services that they are providing, as well as their phone number and website that's available. I also, since we were talking about boosting their social media, they were able to sort of build upon what we were helping them with, and they actually created this on their own. I grabbed this from their social media, but they started doing Faces of Transit campaign where they're now featuring some riders and their experience on the bus. So just one step further from what we were helping them with. And so I really do think that's getting them some good traction that they didn't previously have. So next slide, please. All right, yeah, on to Appalachian.
Hello, everyone. I'm Lena Mitchell. I'm the grant writer for Appalachian Agency for Senior Citizens, but I also served as the project manager for Every Ride Counts pilot program. And I do have the QR codes if you would like to visit our website, along with my contact information as well. Next slide, please. A little bit about Appalachian Agency. We were formed as a private nonprofit in 1975, and we are one of 25 area agencies on aging in Virginia. We serve the residents of Buchanan, Dickinson, Russell, and Tazewell counties in rural Southwest Virginia, which I have highlighted in gold. So we are in the mountain area and rugged areas of Virginia, which is totally different from our previous presenters in Northern Virginia. We also operate 3 divisions in Appalachian Agency. First is Aging Services. Second is PACE, which is the Program of All-Inclusive Care for the Elderly. And finally, Transportation, our public transit. Which is 4-county transit. They are the provider for our 4-county service area, and they are the connection that binds their counties, towns, and residents together. 4-county operates a deviated fixed route. They have specific stops and times, but riders may also request pickup up to 3/4 of a mile off the routes. They are currently operating fare-free since COVID and stop at places such as low-income housing facilities, shopping centers, hospitals, pharmacies, grocery stores, and any other types of these places that people need to go. Riders can also call 48 hours in advance with pickup requests. And now with also our updated website, they can schedule rides that way too. 4-county also provides some limited medical transportation as well as veterans transportation. And the medical transportation services are available for individuals 60 and over who qualify. Next slide, please. And the goals that we identified at the beginning of this project, first, we wanted to increase our ridership. Second, we wanted to educate the public on the benefits of using public transit. And finally, we wanted to engage the public via our social media channel, mostly on Facebook. With our marketing materials, we included a media mix of 20 newspaper ads, 366 radio spots, along with 6 social media ads. Additionally, we requested flyers, 500 flyers, that we could distribute at community events, that we could post at spots in the community such as libraries, convenience stores, post offices, chambers of commerce, town halls, places like that potential riders would frequent. We also requested 1,000 wallet cards that our drivers and staff could also distribute, along with 500 survey cards to gather feedback and suggestions from our riders. On the left of this screen is a sample of the newspaper ad, and in the middle is a picture of one of our staff members distributing flyers at a community event, and then a wallet card on the right side. Next slide, please. These are also examples of our flyer on the left and our survey card, which we did get some really good feedback from our riders on that, along with our 30-second radio script as well. Next slide, please. These are some of our outcomes that I wanted to share. We coordinated the launch of the new and improved four-county website with the beginning of our social media campaign. And the website was redesigned to be more user-friendly and interactive, so visitors could schedule rides and they could also view the routes. As you can see, the social media campaign generated 35 new followers. We had 3,607 ad link clicks, and we reached over 42,000 individuals. And below that, you can see that our website traffic peaked there when we did launch the new website, and we had over 16,000 visitors from March until April. So it was very effective. Some of our feedback that we did receive from riders, they would like to see some more extended hours into the evening, as well as some Saturday hours and some other options for medical transportation. Our ridership did increase during this period. In February, we saw an increase of 1,319 riders. In March, we did see a slight decrease of minus 134, but we picked back up in April with 2,476 rider increase, and we provided a total of 31,908 rides, and we did have an increase at the end of this campaign of 3,661 riders. So overall, we were very pleased that we were able to achieve all of our identified goals. And we also received very positive comments on our marketing materials as well as our new website. So we are very appreciative to NADTC and to the Hatcher Group for helping us achieve these goals. Thank you.
Thank you, Lena. And this is our contact information for the NADTC. And so we're gonna change the format of this and get rid of the slides for right now. We will be sending the slides to the participants. You will have access to them, and we'll be posting them on our website as well. We've gotten, I think, a couple of questions. So there was a question about that was directed to NV Rides about the cost of rides to riders and to volunteers. And Emily and Elena, I wonder if you could take that. I know that you responded online, but in case people haven't read it.
Yeah, I'm happy to respond. So we don't charge by the ride. None of our programs do. A few programs have annual membership fees in order to request a ride, but none of them are charged per ride. None of the volunteers are paid or reimbursed.
And there was a question also about how are no-cost rides funded? So since you don't charge, Emily, I wonder if you could take it there.
Yeah, so we have Elena and I are almost the only paid staff in the network. There's a few others, but most part the programs are run by volunteers. Volunteers drive. We use funding to stretch across the whole region. Like Elena mentioned, we all share software. We have the grant that funds the background checks. So with that one source of funding, we're able to support these 15 programs. Of course, they have their own funding too, but we build a lot of capacity by being an umbrella organization.
And anyone else, Lena, do you want to respond to that? I think some of your rides are no cost, am I right?
Yes, Fort County Transit is funded through the Department of Rails and Transportation. Is that the correct name? I think so. And so
That's the department in Virginia that's basically the DOT. Right?
Correct. And
Yeah.
so they receive funding to operate, since we are the public transit provider for our four-county area. We did, previous to COVID, we charged 25 cents a ride. And because ridership was down during COVID and it was so important we were transporting a lot of our clients to places to be vaccinated and to health appointments, medical appointments. So they decided to get rid of the fares and have been able to continue that now. It may change in the future, but for now we are fare free.
Okay, great. And so yours are through the Department of Transportation in essence. So those are government funds. And Emily, I think yours, it depends on who is the sponsoring organization. It might be government funded or foundation. Am I correct? Thank you. Thank you.
You're correct.
So for NV Rides, unfortunately, we've got another question for you, Emily and Elena. What ways do you recognize volunteers?
That's a great question. We have usually an annual celebration. Each program will also have volunteer celebrations, and we attend those. We try to do like paper plates awards, like most miles, most hours, longest trip, that kind of thing.
Great. And how is liability handled? That's a typical volunteer transportation program.
Yes, the same way I think most volunteer transportation programs handle it, where the driver has their own insurance, the organization has umbrella insurance, everybody signs waivers.
Okay, we have a question also for HopeLink for Laura. Given the wide variety of transportation providers that you work with, have you noticed any differences in effectiveness with fixed route versus monorail versus ferries, for example? So that's a big question,
That's a
Laura.
big question. Find a Ride did a soft launch on community testing with the Find a Ride and Every Ride Counts marketing materials last year. This year, we're moving into our 3-county launch phase. We're still not at the radio spot bus ad level that some of the other folks here are. There's a lot we're learning from the other pilot projects, and hope to kind of follow in those footsteps and take their lessons learned and apply them as we get ready to expand kind of the reach of the program. But we do have people that sit on our advisory committee from the larger agencies. And so the way we evaluate success, we do partner satisfaction surveys. We, ask them to include questions about our program when they reach out to their communities. But how we evaluate the effectiveness of Find a Ride, since we are not the transit provider directly, does get very complicated. We could do a whole webinar on that.
No doubt about it. And for those, and Emily, I'm coming back to you. How do you qualify your volunteer drivers?
So we have a training, we do face-to-face. They all are background checked. They have to provide proof of driver's license and insurance that meets state standards. We make sure they are who they say they are. And then there's ongoing refreshers we'll hold, like how to use our software, updates. They're all mandatory reporters. They get the mandatory reporting brochure from the state.
Okay. We also have another, let's see. Let me make sure I've got this. So how do you handle challenging riders? And I think that's for everybody. Those that take advantage of the system are volunteers, and those that really need more help than volunteers can give. And I'm sure that does come up in Northern Virginia a little bit, since you require your riders to be able to get into the vehicle without assistance, pretty much. And so are there referral services in particular that you use, I guess is the question.
Do you want us to take the question, or I don't know if I'm sure other people have some experiences. I can speak super briefly that
Well, I was
yeah.
just saying, if your program cannot provide the services, are there are there referral services you can use?
Yeah, we'll refer them usually to a paid service, or we keep a list of all the insurance phone numbers, and we'll refer them to their insurance company. Sometimes insurance benefits will provide that assistance. We always use the verbiage, we never lift, move, touch, or transfer, and that seems to communicate it pretty well.
And there are lots of questions here about volunteer transportation. I don't mean to ignore them, and I'm not going to, but I think the purpose of this webinar is really to talk a little bit about program promotion. So we will record all these questions and make sure that you all who have asked questions, that all of the folks on the call get responses to questions that we are not getting to today. And I wanted to just turn to our presenters for a minute and have you talk a little bit about how you engage with riders as you develop your promotional material, older adults, people with disabilities, and people with low income. So how you engage with riders. So I'm going to start with Lina. Could you start with this response?
In addition to being the public transit provider, Fort County Transit also takes our congregate site. We have 8 congregate sites that we operate, nutrition sites, and they transport our participants to and from those sites. So we had direct access to a great group that we could get feedback from, and we did get feedback from, and they are not shy to share their thoughts and their wishes. They had a big wish list. So we tried to take that and condense it down into our marketing materials in hopes that we could reach the right people. So I think it's really important to know your riders. And know your target audience. Sometimes they're the same and sometimes they may be different. So I think that's very important to know who you're trying to target with your marketing materials and to take that feedback and translate it into something positive.
And Laura, anything to add to that?
Yes.
Sure.
So our trip planner, it's still in development on a multi-year, multi-phase roadmap. And we have a nothing about us without us, not just our mobility for all framework that we work in with our inclusive planning, but also in Washington State, there was a law passed by many of our partner organizations and advocates that represent people with disabilities in particular, that anything you do, you do alongside those communities from day one. And so we have honorariums where we give stipends to folks that participate in our advisory committee. We provided gift cards as part of the Every Ride Counts campaign. When people engaged with the QR code, they were given the opportunity to get a grocery store gift card. And that ended up so that the feedback we were getting during that very important phase really was from, excuse me, low-income communities as well.
Emily and Elena, anything to add to that in terms of involvement of riders or volunteers in developing your promotional materials?
Yeah, this project gave us a really good chance to sit down with our volunteers, and that's how we learned about their messaging that they prefer. They were like, don't put a picture of a car, put a picture of us having a great time drinking coffee. And so I learned from them and we implemented a lot of what they said. So we asked and we did what they told us.
Yeah, and I think one of the things that's clear from these projects is that everybody worked on a specific issue in their community. And you saw that some of the images were used in different ways by different programs. So some of the images were unique to a project, and others were just simply, they were available on the Every Ride Counts site and they were used. So Jeremy, I didn't know if you wanted to add anything about the 2 programs that you work with, Mountain Rides and Thrive Allen, about how they engage with older adults and people with disabilities.
Because Thrive was so new, I don't have much to add there. But with Mountain Rides, they did have a lot of good community connections. They did a lot of outreach to the medical facilities to understand what their needs were. They understood proper drop-off locations at the facility just by having those conversations. So they were able to network and understand the actual needs of those facilities. And as I mentioned before with mountain rides, they quickly understood that not everyone on their what they called a medical route were all going to medical appointments. So some people were actually going to work, and so they were trying to understand that, as well as trying to connect with the Spanish-speaking population as well. And so that was kind of their first request, was to create materials in Spanish. That way they could do proper outreach to that particular community.
Thank you. And I did want to ask about the feedback that you got from others on using Every Ride Counts materials. Whether or not you got any criticism. I heard that a couple of the programs definitely had a lot of input from their advisors on what they wanted to see. But I wondered if you went into a slightly different direction than you thought in the first place, or whether this project enabled you to identify some issues that you had been using that you thought were successful in communication, that maybe it coalesced a little bit, and what you learned basically from this project. So anyone can start.
I'll go ahead. I'm not part of transit, but I've learned a lot about public transit through this project and a couple of others. One thing that I did see is the need for us to update our marketing materials and our website. It was very antiquated. Our website it was totally user friendly. And so this, I think, prompted us to make some very needed and very good changes to the website. We could tell hand in hand with the social media ads that it really did affect our visitors, which hopefully affected our ridership too. So I guess what I'm saying is sometimes it takes someone else or something else to prompt you to look with a critical eye at yourself. And that's what we did. And I think we have a much improved total product now.
Anyone else?
I can speak to this. This is Laura Lowe at Hope Link in Western Washington. And I think that what we've learned since we developed our infographic in particular is that while really dramatic and great, our big poster size is not as useful as just a good old 8.5 by 11 flyer that people can, or partner organizations can print on their own and put up in their communities and things like that. So, we didn't focus as much on the kind of basic material, and the infographic that looked great on an 11 by 17 is too much information for a small flyer. So what we've had to learn since then is to really hone in on what to cut out. And so it's not just you can take the larger stuff and just scale it down and it's ready to go. So many of our community members are blind and low vision, and our advisors are as well. So there's a high degree of keeping things very simple, high contrast, large print, large font size, and really paring down information to the essentials. So that's a lesson we've continued to learn. And but honestly, just like the last speaker said, because of this, it jump-started conversations that we would have had maybe further down the road, and it allowed us to get ahead of where we would have been if we hadn't been part of this. So really set us up for some great success in the future.
Great. Emily, anything to add?
Just, yes, I'm echoing what the other presenters said. I think the real takeaway is that, and you can see that from everybody, is trifold brochures are kind of out right now. And that grip cards, palm cards, that's what people find eye-catching and easy to use. And I think it kind of permanently moved me away from trifold brochures and kind of thinking of really simple, high contrast, easy to pick up materials. So
Interestingly enough, I'd say that we at NADTC have made that same observation, and we're trying to follow along with you guys. So we appreciate what you all learned. And there was another question about the budget that was used, or how did you decide how much money you could spend on this project? And we had a limit at NADTC, but it was a fairly generous limit, and there was negotiation between the local program and our contractor, Hatcher, in terms of what they could afford and what they could do. I don't think anybody really got turned down for anything that they were trying to do. But I think it raises the issue of cost is always a factor. And we do have a number of materials on the Every Ride Counts section of our website that includes guidance for creating a publicity campaign. So there is a document that can walk you through that, including identifying free sources of publicity that you can take advantage of. The other thing I would say is the report on these 5 programs is also available on the Every Ride Counts website, and we encourage you to take a look at it. It's a lovely report, and it includes lots of information that we were not able to share during this 1 hour long website. And finally, I will say we will respond. There were a lot of questions about volunteerism that are coming your way, Emily. And we do have a number of resources on our website at NADTC that are focused on volunteer transportation. So do take a look at those as well. But we will follow up on the questions. The recording of this webinar will be on our, it will be sent to you all. You all will have access to it, and we will post it on our YouTube channel. And finally, I think Meredith is posting an evaluation. So we ask you to please click on that evaluation and let us know how we did. And if you've got any more questions, just send them our way. So Jeremy, I'm going to turn to you for last word.
Thank you so much for to all of the pilot sites. I think we all learned a lot. I like that each of you included that you learned along the way. And we didn't mention a lot, but we did work with a consultant, Hatcher, who helped guide this project along. And they were able to give industry expert advice on what types of materials were being used in the industry and how to go about that. And we gave them the ideas and they just ran away with it and produced the materials alongside of us. So big shout out to Hatcher as well. But thank you all for joining, and thank you again to the pilots.
Yes, I can't thank you all enough. You all have been just absolutely wonderful partners. We really, truly appreciate the great work that you all have done. And we will be continuing to do more work on our Every Ride Counts site. So stay tuned. You'll hear about that via our website and our e-news. So if you're not getting it now, please sign up for it. And with that, we're out of time. So I'll say, sayonara, everybody. Have a wonderful afternoon, and thank you again to our great speakers. We appreciate it. Bye-bye.